what would you say is the worst thing about the Republican health care bill?
I don't know how anyone defines success when you talk about health care reform as taking health care away from 24 million people. I don't know how anybody defines success as saying that schools that depend on special education funding for to educate special needs students, why cutting that is success. I don't understand how stripping the consumer protections around essential health benefits, ensuring that somebody that's suffering from opioid addiction can actually get addiction treatment, ensuring that a family that's welcoming a new child into this world can actually get the maternal care and newborn care covered by insurance. I don't see how stripping those protections away is any way you can define success. I don't see how Medicaid, which is the largest payer of long-term care in this country, it's the largest payer of behavioral health and mental health care in this country, how gutting that to the tune of close to $900 billion is a success, and I certainly don't understand how you could define success as taking that money and passing a $600 billion tax cut onto the wealthy. What I would ask my member is to understand why they think that this bill, in any stretch of the imagination, solves any of the problems that their constituents face with regards to health care. Because the fact of the matter is, it doesn't. Any independent analysis that we've seen, the CBO even said from the earlier version of this bill that premiums were going to go up, that cost of care was going to go up, that the costs were going to go up for the elderly, and that rural communities were going to be devastated. There's no answer for those critiques from our Republican colleagues. The only thing this bill does is it solves a political problem for them about trying to satisfy a base where they made a promise to that they know that they believe that they had to keep, which was repealing Obamacare regardless of the cost. And I have yet to see any sort of realistic justification from any Republican colleague as to how this bill solves any of the problems that we've seen across our healthcare community, other than saying, yes, well, it might reduce costs. Well, the analysis, again, says not for an awful lot of folks. Mm-hmm. And when it actually comes to the quality of the care that's actually delivered, I don't think that's true either, right? I can sell you a car that doesn't have seatbelts, doesn't have airbags, doesn't have brakes, and it's going to be cheaper than one that does. The quality of that car is suspect at best.